nursing student for today.
Hi.
I'm just going to do a full head-to-toe assessment. So what that is I'll be taking a look at your body. I'll also be listening with my stethoscope and also touching and palpating. Is that okay with you?
Okay.
All right. Can you give me your name and date of birth?
Judith Allo, October 28, 1962.
Okay. And do you have any allergies?
None that I know of.
All right. So for general assessment, patient is an age-appropriate female. She is sitting upright. Her hygiene is good. She's showing no signs of pain or discomfort. For orientation, can you tell me your name again?
Judith Allo,
Can you tell me where you are?
in the hospital,
Can you tell me what year it is?
2020.
Okay, and why are we here?
I just need to be assessed.
Okay, so patient is alert and oriented ×4. So I just have a couple questions for you. Are you taking any medications?
No,
Are you shortness of breath?
No.
Do you have a cough?
no,
Okay, do you smoke?
No.
Do you exercise?
not regularly.
Okay, do you have any family history of heart problems?
No,
Have you had any abdominal surgeries before?
no,
How long have you had your glasses?
maybe 5, 6 years.
And has there been any changes recently?
No,
Okay, do you have any other corrective devices?
no,
All right, and do you have any disability to do any daily activities or moving around?
no.
Okay, I'm going to test for cranial nerve number 7, which is your facial nerve. So I'll have you smile for me, puff out your cheeks, and raise your eyebrows. Good, so cranial nerve 7 is intact. So I'm going to start with your lips. So lips are symmetrical. They're also pink and moist. I'm going to have you open your mouth and then say ah for me. So uvula is in midline and it rises when she says ah. She has no signs of dental caries. All her teeth are intact. Her oral mucosa is pink and moist. No signs of lesions. Her tonsils are 1+. I'm going to take a look at your eyes. So can you take your glasses off for me? Thank you.
You're welcome.
So her sclera is white. Her conjunctiva is clear as well. Eyes are symmetrical and parallel. Can you bring your eyelids down for me? Her conjunctiva is clear as well. Okay, I'm going to put a light against your eye now so you can just look straight ahead or look at my shoulder. Pupils are equal and reactive to light, and now we're going to try accommodation. So if you could just look at the wall and then look at my pen light. Okay, pupils also reacted to accommodation as they converged and constricted. So now I'm going to have you follow my pen light. All right, so patient was able to follow my pen light and no nystagmus was noted.
Now listen to your heart now with my stethoscope, okay? So just gonna take a look at your chest. So upon inspection, the chest rises and falls with no effort. No heaves noted. No obvious scarring or pulsations are also noted. Okay, so I'm going to be at the second intercostal space on the right sternal border listening to the aortic valve. S1 and S2 are heard. S2 is louder than S1. Now I'm going to the left sternal border, second intercostal space, listening to the pulmonic valve. S1 and S2 are heard. S2 is louder than S1. I'm going to go down to the third intercostal space, listening to Erb's point. S1 and S2 are heard and they are both equal. Going down to the fourth intercostal space, listening to the tricuspid valve. S1 and S2 sounds are heard. S1 is louder than S2. I'm gonna go to the side and I'll have you just lift up your breast for me. Okay. So I'm at the fifth intercostal space in midclavicular lie, listening for the aortic valve or mitral valve. S1, S2 sounds are heard. S1 is louder than S2. Upon auscultation, I did not hear any extra heart sounds or murmurs. All right, now I'm going to take a look at your arm. So I'm going to feel it. Let me know if there's any pain, numbness, or tingling. Anything?
No.
All right. Temperature is warm throughout and skin is dry and intact. Olecranon processes are blanching. No erythema is present. I see no erythema or signs of ecchymosis. Her skin turgor is good. Checking her cap refill, and it is less than 2 seconds. And now I'm going to feel for your radial pulses. Radial pulse is 2+. I'm going to check your other arm. Radial pulse is 2+. They are 2+ and equal bilaterally. All right, I'm going to look at your legs now. So any numbness, pain, or tingling?
No.
All right. Just checking for temperature. Temperature is warm throughout. Skin is intact and dry. No erythema is present. I'm going to test for edema. Pressing on the tibial plate. No edema is present. Doing it on the other side. No edema as well. I'm also going to check for cap refill. Cap refill is less than 2 seconds. Do it on the other side. Good, less than 2 seconds. I'm also going to check your dorsalis pedis pulse. All right, 1+. Check here as well. Left side is 1+, and they are equal bilaterally. Okay, so now I'm gonna listen to your lungs. But for upon inspection, the chest rises with no effort. Her breathing is non-labored. No heaves present. Now I'm gonna take a listen. So every time I put my stethoscope on you, just take a deep breath with your mouth open.
Okay.
All right, we have to redo. I'm already recording.
Oh, sorry.
Hi.
Okay, so before I listen to your lungs, I'm just gonna take a look at your chest. Your respiratory rate is normal. No unlabored. Your breathing is unlabored. No signs of accessory muscles are being used. Now I'm gonna listen. When I listen, when I place my stethoscope on you, just take a big deep breath with your mouth open, okay?
All right, and then I'm going to listen to your lower lobes. So if you could just bring your chest up a little. And breathe with your mouth open. One more time. One more time. All right. So listening to her anterior side, I heard bronchovesicular more in the midline and vesicular on the lateral sides. So now I'm going to listen to your back. Again, just take deep breaths when I put my stethoscope on you, okay?
Okay.
I'm going to listen laterally now. I'm listening to your right middle lobe. Alright, so I heard bronchovesicular sounds again in midline, and laterally I heard vesicular sounds. I heard no adventitious breath sounds anterior and posteriorly. Okay, I'm going to look at the abdomen now. So just upon inspection, no obvious pulsations. Abdomen is non-distended. She does have a scar right on the bottom. What scar is this from?
From ICS.
Okay, and how long ago was that?
23 years ago.
Okay, so scarring has healed well. I see no obvious hernias. Now I'm just going to listen. I heard normal active bowel sounds on all 4 quadrants. If I did not hear any bowel sounds, I would have to listen on each quadrant for 5 minutes before I say that she has no bowel sounds. Now I'm going to palpate just lightly, okay? So if you feel any tenderness or pain, let me know.
Okay.
Any tenderness or pain?
No.
Okay, now I'm going to do deep palpations. Any tenderness or pain?
No.
Good, and as I palpated, muscle tone was even throughout and no obvious masses. I'm going to do indirect percussion to perform costovertebral tenderness. I'm going to tap, and then you are just going to tell me if you feel tenderness or pain. Any tenderness or pain?
No.
Okay, good. Okay, so now we're going to test your range of motion, so I'm just going to have you follow me, okay? So for your shoulders, you're going to bring your arms forward for flexion, and then back for extension. All right, and then you can go back. And then you could bring it up to the side for abduction, and then back to the center for adduction. Good, and then for your elbows, you're going to flex your arms towards you for flexion, and then bring it out for extension. Then you're going to bring your arms up, so this is supination, and then for pronation, good. And then you're gonna bring your arms in for internal rotation and then out for external rotation. Good, so range of motion, she has a full range of motion. Now I'm gonna test her strength. So if you could just face me. So I'm gonna apply resistance, and you're just gonna bring your arms out. Good, and then now bring it in. Good, and then now for your elbows, I'm gonna pull to me and you're gonna pull towards yourself. Good, and then now push. Good. Her strength is 5 out of 5. I'm gonna have you squeeze my fingers for me. Good. 5 out of 5 strength. Now we're gonna do your legs. So again, just follow me. So have your legs bring it out to the side for abduction, and then back in for adduction, and we'll do the other leg. Abduction, and then adduction, and then in front of you for flexion, and then behind you for extension, and the same thing with your other leg. Good. And then I'm gonna have you go to your side. And then you're just going to flex your knee for flexion, and then bring it out for extension. Good, and we're going to do the other leg. Flexion and extension. Good. So now I'm going to test your legs for strength. So I'm going to push against your leg, and you just bring your leg up for me. Good, and other leg. All right, and then you're going to lift, and I'm going to lift, and you're going to bring it down. Bring it down. Good, and your other leg. Good. Now we're going to test your knees. So I'll have you kick out for me, and I'll push in. Good. And your other leg. Good. And then now you're going to bring it in. Good. And your other leg. Good. Now I'll have you step on the gas for plantar flexion. Good. And then bring it back up for dorsal flexion. Good. Her lower extremities had a 5 out of 5 throughout for strength. Is there anything I can do for you now?
No.
Okay.
Thank you.
Thank you. Okay.